Hello, folks. Today we're diving into a topic that might be of interest to many young athletes out there. Osgood-Schlatter disease. Picture this. You're a budding sports star, but you're suddenly benched by a mysterious knee pain. Frustrating, isn't it? Well, this is a reality for many adolescents, thanks to Osgood-Schlatter disease. This condition, often simply called OS, is a common cause of knee pain in growing adolescents. It's especially prevalent among those engaged in sports that involve running, jumping, and swift changes of direction. So, if you're a basketball prodigy or a soccer wunderkind, listen up. This could be important for you. But don't worry, we're not here to rain on your parade. We're here to shed light on this condition to help you understand it, tackle it, and get you back in the game. Stay tuned as we delve deeper into this intriguing medical mystery. You may wonder why Osgood-Schlatter is common among young athletes. Well, let's dive into the causes of this knee condition. Picture this. Your body is a well-oiled machine. But during adolescence, the machine goes into overdrive due to growth spurts. Now, the rapid growth of bones, muscles, and tendons may not always occur in harmony. The thigh muscle, or quadriceps, can pull on the tendon that connects the kneecap to the growth plate at the top of the shin bone. This area is called the tibial tubercle, and it's not fully developed in adolescence. So, when there's too much tension from the quadriceps, it can cause inflammation and even tiny fractures in the tibial tubercle. This is the crux of Osgood-Schlatter disease. Now, why is this more common in young athletes, you ask? The answer is simple: overuse. Adolescents who participate in sports that involve running, jumping, and swift changes of direction put extra stress on their knees. This overuse, combined with growth spurts, can trigger the onset of Osgood-Schlatter. But here's a little plot twist: it's not exclusive to athletes. Any adolescent experiencing a growth spurt can develop this condition. The knee doesn't discriminate. It's all about the stress placed on it. However, remember that every adolescent's growth pattern is unique. Some might grow rapidly over a short period, while others may experience slower, steady growth. Similarly, the onset and progression of Osgood-Schlatter can vary from person to person. It's like a knee mystery unfolding during the adolescent growth saga. So in a nutshell, the causes of Osgood-Schlatter are like a perfect storm. The combination of growth spurts, overuse, and stress on the knee joint. This is why it's common, but not exclusive to young athletes. It's a knee condition that doesn't play favorites, affecting anyone who meets the conditions for this perfect storm. Now that we know what triggers it, let's explore how painful this condition can be. No one enjoys pain, but it's a part of Osgood-Schlatter. Now, when we talk about pain, it's important to note that it's a subjective experience. For some, it's a minor inconvenience, a dull ache that can be shrugged off. For others, it's debilitating, a sharp pain that can make the simple act of walking feel like a marathon. In the case of Osgood-Schlatter, the pain typically presents itself just below the kneecap. It's often described as a throbbing sensation that intensifies during activities like running, jumping, or bending the knee. The pain can range from mild to severe, and it can seriously impact a young athlete's ability to perform. Imagine being a promising soccer star, having to sit out the entire season because every kick sends a jolt of pain through your knee. It's not just the physical pain, but the emotional toll it takes as well. So, it's painful, but can it go away? Many of you may be wondering, will this knee pain ever end? Well, let's talk prognosis and treatment for Osgood-Schlatter disease. It's like the weather, it may be stormy now, but it can't rain forever. First things first, let's talk prognosis. The good news is Osgood-Schlatter often resolves on its own. That's right, no magic potions, no secret spells, just good old-fashioned time. Most cases resolve as children stop growing and reach skeletal maturity. But remember, every young athlete is different, and so is their recovery timeline. Now let's move on to treatment. Imagine your body as a sports car. You wouldn't drive a Ferrari on a flat tire, would you? Similarly, you need to give your body the proper care it needs to perform. Treatment for Osgood-Schlatter is primarily focused on managing pain and swelling. First up is rest. Yes, I know it's the word no athlete wants to hear, but sometimes it's the best medicine. Limiting activities that cause pain can help the knee heal. Next, physiotherapy is often recommended. Think of it as a personal trainer for your knee. Physiotherapy can help strengthen the muscles around the knee and improve flexibility. Over-the-counter pain relievers like ibuprofen can also help manage pain and reduce inflammation. But remember, always consult with a doctor before starting any new medication. In rare cases, when the pain is severe or continues into adulthood, surgery may be considered. However, this is generally the last resort. Another helpful tool in the arsenal is a knee brace or strap. It can provide support and help reduce tension on the tendon, making it a potential best friend for your knee. In conclusion, the journey with Osgood-Schlatter may feel like running a marathon with a few hurdles thrown in. But with the right care, patience, and possibly a great physiotherapist, young athletes can leap over this hurdle and get back in the game. Osgood-Schlatter may be a hurdle, but it's one that many young athletes can jump over with proper care. We've covered a lot of ground from what Osgood-Schlatter is to how it's treated. We've delved into the causes, the pain scale, and the prognosis of this common adolescent knee issue. We've answered your burning questions from can it go away to will it show up on an X-ray. We've even shed light on the potential long-term effects and the role of knee braces in recovery. It's a lot to take in, but knowledge is power, especially when it comes to our health. Now it's your turn to spread the word. Share this video with your friends, coaches, teachers, and anyone else who might benefit from understanding Osgood-Schlatter disease. Smash that like button if you found this video helpful, subscribe for more enlightening content, and don't forget to ring the bell to stay updated on our latest videos. Remember, always consult with a doctor or qualified healthcare provider for any health concerns. Thanks for tuning in, and until next time, keep moving forward.